Hey guys, I'm trying to make a video to kind of standardize the post-op instructions. Everybody's got their own way of doing things, so I'm not going to be picky about things. At the end of the day, we just want patients to be comfortable. We want to make sure that that patients don't have a lot of questions. So if we're missing something in our instructions, we might end up seeing more phone calls on the front end. We might end up seeing a lot more patients who are coming in who just didn't understand what they were supposed to do afterwards. This rule number one: keep it as simple as possible. I know everybody's trying to get the patient out the door. Keeping things simple makes things more likely to be followed. The more numbers, the more dates, the more times you give, the more the patients will mix things up. The message that you want to convey with these things at the end of an extraction is essentially that everything's going to be okay. The other part that I really want emphasized is that instructions are written down, and also instructions will also be texted to the patient as well, and that if at any point somebody has questions, don't hesitate to let us know. Okay. I kind of had Sean go through her version of post-op instructions. I'm going to kind of mix her version with mine. So patients, I like to ideally have the instructions given at a downtime when I'm not in the room, when I've numbed the patient and now you've got, let's say 5 to 10 minutes to kind of go over things with the patient. Patient has, full attention. Patient's not worried about the stressful part of the surgery, and they're not anxious to get out of there. So let's say, hey, right now you've got gauze inside of your mouth. You want you to go ahead and bite down on that for about 10 to 15 minutes. When you get home, you can take that out. It is okay if there's a little bit of slight oozing, but if your mouth does fill up with blood, then we want you to go ahead and use some of the extra gauze that we gave you, fold it down or wad it up, and go ahead and put it where the extraction site was, and make sure that you gum down on it, put pressure on the wound. If it's getting to the point where you can't control it, please obviously give us a call. Also, if the gauze doesn't do the trick, then a moist tea bag might work just as well. There's a problem taking things in and out over and over can make it bleed more often. If we did use sutures on you today, those sutures are dissolvable. They'll last anywhere from 3 to 5 days. If they do come out early, that's also no big deal. Ice is helpful. Ice is one of the things that can also make it so that you'll have less pain. It's kind of like a pain medication. We don't see a lot of swelling, but if you do, ice is going to be helpful for that as well. Our instructions say 20 minutes on, 20 minutes off, but you can leave it on longer than that. We just want to make sure that you have something in between the ice packs and your face so that you don't get a freeze burn on your face as well. As far as food goes, eating a softer diet for up to a week is a reasonable thing to do. Soft and cold is my recommendation. Definitely avoid things that have sharp edges, small things like peanuts or pretzels or popcorn. And we do also recommend avoiding a straw for 4 days. That suction can create a problem from that as well. As far as rinsing goes, still want you to brush and floss like you normally would do with the remaining teeth that are still comfortable. Mouthwash can be started right away, but we want you to kind of rinse less vigorously and also make sure that you lean over the sink, let things dribble out. You can start that mouthwash that we've given you, if we did give you one, 3 days later, and that way things can be a little bit more comfortable for you. As far as pain goes, we did provide prescriptions for ibuprofen. If you're able to take that, we can add Tylenol over the counter into that as well. In our take-home bag, you'll notice a clock that can tell you, they can give you the times to take those, help you set a schedule for that. And again, don't forget that ice is a good pain medication as well. As far as the other prescriptions that we may have given would have been antibiotics, which we'll usually give for about 3 days afterwards. Obviously, if you have any questions, concerns about anything, please feel free to call the office. Also, the doctor's cell phone number after hours is available as well inside that take-home bag also. Alright guys, I think that was bumbling and mumbling. I have my own little thing, and I tried to add Sean's in as well. But at the end of the day, we want to make sure that you hit these things. You want to talk about bleeding and what to do if you have bleeding. You want to talk about pain. You want to talk about swelling. You want to talk about hygiene, brushing, flossing, rinsing. You want to talk about what people can eat for afterwards. You want to make sure the patients know if they have stitches that they are dissolvable. Super common question. And then usually go over the prescriptions also. And then again, lastly, my message is, hey, if you do have questions or concerns, don't hesitate to call us. All right. Thank you.